So the key thing to remember here about the muscle is that, and I know you exercise a lot, pretty much once that muscle gets stretched beyond its happy length, you can do sit-ups till the cows come home and it's never really going to tighten back up. You can get a really strong muscle. It's just not going to shorten the muscle or tighten the muscle. So that's what we're doing surgically, is we're essentially installing an internal corset, like one of those old-fashioned lace-up corsets, that's going to retighten the muscles and pull those muscles back together. They tend to get pulled apart. We call that diastasis recti.
Okay.
But those muscles get spread apart and they get a little bit stretched as well. Okay, so the reason for implant exchange, obviously in your situation, is a size preference. You know, it would seem great as a size when you're in your 20s. Now it's like, maybe that's a little bit too big, so you want to have a slightly more conservative size, but yet we still want to try to preserve cleavage, preserve some upper pole fullness. So we'll go with an implant that maintains that nice diameter but doesn't project out as much. The lift is going to help because you've been through 3 pregnancies, so your breasts have stretched and relaxed and stretched and relaxed 3 times, so that skin's gotten a little stretched out. So what we're going to do basically is we're going to tighten the skin envelope around that now smaller implant to give you a nice perky shape. Essentially, a scar, like if you're envisioning your breast kind of perky up here where you want it to be, there'll be a circle around the perimeter of the areola, and then a vertical scar going down to the bottom. Probably have a very short horizontal scar, similar to what you have now for the breast augmentation, but hitting that crease. So lying on your back, looking at your full breast, it'll look like a small anchor. When you're standing up in front of the mirror, all you see is the top of a lollipop.